Hello, it's Dr. Pat at Little Critters, and we have Peanut with us today. She's a 3-year-old guinea pig, and she is a beautiful little guinea pig and a long hair, as you see. She's owned by a little girl who does a wonderful job in caring for her and grooming her. When you have these long hairs, just as a side point, they will get very dirty. They don't groom like a cat, so you do need to brush them, prevent matting, and clean them regularly. This is a recheck for Peanut, but she was seen initially for blood in her urine and straining to pee and crying or vocalizing when she was urinating. And the little girl, who's very astute and very aware of Peanut, brought her in right away. And we did take some x-rays on her and noticed what we call calciuria, or sludge in the bladder. And calciuria is basically an increase in calcium carbonate crystals in the urine, which they normally have in their urine. And it can build up to larger levels in the bladder if it's not being passed. And on an x-ray, it looks like white sand in the bladder, so we often refer to it as sludge. And this is very, very common in guinea pigs. Females and males are predisposed to actual urinary stones and certainly sludge in the urine. It can be related to several factors. Diet is one of them. The other issue with guinea pigs, and this is true of rabbits as well, is they often become sedentary as house pets. They're not moving as much as they should. I see that more in rabbits than guinea pigs, but I do see it in both. And what happens if you think of a snow globe, the little flakes of snow would be equivalent to the calcium crystals in the urine. And if you have a snow globe and it's just standing still, all of that snow settles on the bottom. And that's typically what happens with these calcium crystals. However, if you shake the snow globe, they're all suspended. So the analogy really means if she's moving and active, she's kind of mixing up that urine, and then when she pees, she's getting rid of some of those crystals. So getting them more active is really important. Foraging is one way to do that with guinea pigs. The other issue is just hydration. So we want to increase the water content so that they're peeing more frequently and flushing that bladder out more normally. And you can do that a few ways. One of the ways we do all the time is we just wet down their greens, so they're getting more moisture than they think they need. Some guinea pigs, if you moisten their pellets, will eat the soaked pellets. So it depends on the pig. You need to watch them. And when it's really severe, we'll often put a plain white salt block in with them. Not a mineral block, not a colored block. And no, we don't normally give those to guinea pigs. But when we have this problem, we do everything we can to get him active, drinking, and peeing more. And salt just causes them to drink more and pee more, so it can be very helpful. With severe cases, we often have to catheterize and flush these out. And with bladder stones or urethral stones in guinea pigs, sometimes, particularly in the females, they're farther down in the urethra, and we can anesthetize and actually use a hemostat and go in and pull the stone out. Really big stones in the bladder do require surgery. So you want to do what you can to prevent this, because it's very common, and a bigger problem in male guinea pigs because they have a long, thin urethra, and so if they get a stone in there, they're fully plugged up, and then we have an emergency. So that's calciuria or sludge in guinea pigs, and there's a lot we can do to try to prevent it. And Peanut is in for the recheck. She is clinically normal now. She's not passing any blood in her urine. She's not crying or vocalizing. She's well hydrated, and her mom is working on pretty much everything we just talked about and seems to be a very happy pig.